How's your sense of smell?
Why are you so interested in my sense of smell?
It's fine.
You might have Kalman's, nasal polyp, a blocked nose, or a 4-3 fracture through the cribriform plate.
And how about your sight? Any problems there? You've able to watch the telly?
Why didn't you test my vision properly?
How's your vision?
Fine.
If you can read a paper and watch the telly, it's probably fine. If you were diabetic or it had changed, I'd want to test it more formally.
Accommodation?
Not much use in clinical practice.
You blinded me.
The optic nerve is afferent and the ocular motor efferent. Damage to the optic nerve results in a relative afferent pupillary defect.
I'm not convinced that you tested my visual fields properly.
I used the bridge of your nose to block off nasal fields and just tested temporal loss. You'd have noticed a nasal defect.
You didn't do an H shape.
A simple wide plus shape is enough to test eye movements. If there is double vision, the weaker eye always casts the outer of the two images. Parallel images suggest a sixth nerve palsy.
Why did I have to clench my teeth?
Fifth nerve palsies are really rare. Sometimes sounds seem louder because of tensor tympani paralysis.
You kept touching my face.
Complaints of facial numbness are fairly common, so it's important to know that the ophthalmic division of 5 extends up to the vertex, down to the tip of the nose, interdigitates in the midline and innervates the cornea. The second division supplies a patch under the eye, and the third the chin, but excludes the angle of the jaw, which is innervated by C2 and 3.
Why did I have to pull silly faces?
An upper motor neuron facial palsy, typically a stroke, spares the upper face, so you can still raise your eyebrows. In a Bell's palsy, the whole ipsilateral side of the face is paralysed.
Fantastic.
You know I can hear.
I know, and if you had a hearing aid, the problem is clearly being dealt with.
Yes.
Can you hear that?
Yes.
And that?
Yes. Yes. Yeah.
And that?
Yeah.
Any trouble swallowing?
No.
Any problem swallowing at all?
No.
Did you need to test my gag reflex?
No, as long as you can swallow safely, you're fine. It's easy to test with a sip of water.
Why did you get me to shrug my shoulders and wrestle you?
It is difficult to detect weakness with such powerful muscle groups, but they are genuinely very weak in myotonic dystrophy. It was also quite fun.
Fantastic. That's great.